If you're past 60 and you notice that your intimacy doesn't respond like it used to, this video is for you. There are 4 fruits that help improve blood circulation throughout the body, including the intimate regions, and when consumed within a healthy routine, they can be part of the solution. But before I present those 4 fruits to you, I need to be very honest with you, because scientific honesty differentiates information that takes care of you from an irresponsible promise. The title promises that your vitality goes back to 18 without medication. That's a catchy simplification that can mislead you. The truth is more subtle and much more important for you to understand. In men over 60, the difficulty getting an erection, what doctors call erectile dysfunction, affects more than half of men at that age. And in 7 out of 10 cases, the main cause is vascular. That means the penile artery, one of the smallest in the body, is the first to suffer when cardiovascular disease begins. Erectile dysfunction at 60 can be the first sign of coronary heart disease, appearing 3 to 5 years before a heart attack. So this video needs to do something very important. Take you to the doctor, not away from him. The 4 fruits help, yes, but they're support, not standalone solution. Come with me, I'll explain everything calmly, with responsibility and with scientific basis. Before I tell you about the fruits, let me reinforce the most important warning of this video. Erectile dysfunction at 60 or older is not just about aging. It's a signal that deserves medical evaluation. The most common causes are cardiovascular disease, poorly controlled diabetes, high blood pressure and its medications, smoking, obesity, sedentary lifestyle, sleep apnea, low testosterone, some antidepressants, prostate problems, and psychological aspects like performance anxiety, depression, and relationship issues. So, before or along with any dietary change, schedule a consultation with a urologist and cardiologist. Do basic exams, blood glucose, glycated hemoglobin, cholesterol, triglycerides, kidney function, male hormones, electrocardiogram. These exams can save your life, and never ever stop your medications without talking to your doctor. If you take medication for blood pressure or depression and notice it may be interfering, bring that question to your doctor to adjust. Stopping on your own is dangerous and can cause stroke, heart attack, depression relapse. Your safety comes first. And one more essential warning. If you take nitrates, which is medication for angina or for heart attack, like isosorbide or nitroglycerin, never use sildenafil, tadalafil, vardenafil, or similar without medical authorization. The combination can cause severe drop in blood pressure and even death. Always talk to your cardiologist before any medication for sexual function. If you're not yet subscribed, click the subscribe button now and turn on the bell. Tell me in the comments where you're watching from. If this video is useful, share it with someone you love. The first fruit is watermelon. Watermelon contains a substance called L-citrulline, mainly in the white part close to the rind. L-citrulline is converted in the body into L-arginine, and L-arginine is the precursor of nitric oxide. Nitric oxide is the molecule that signals arteries to relax and dilate, improving blood flow throughout the body, including pelvic vessels. An Italian study published in 2011 with 24 men with mild erectile dysfunction showed that L-citrulline supplementation for 1 month modestly improved erection quality in some participants. But attention, the effect is modest. Watermelon does not replace sildenafil, and the amount you'd need to eat to have effect is large, around 200 to 300 grams of pulp per day, regularly for weeks. How to use: prefer ripe watermelon, and also take advantage of the white part near the rind, which has more L-citrulline. Eat a medium slice at lunch or as a snack 3 to 5 times a week. Diabetics, attention to glycemic index. Consume in moderate portions with other fibers. The second fruit is pomegranate. Pomegranate contains punicalagins, which are potent antioxidants, and also anthocyanins and tannins. These compounds have effect on oxidative stress, which is one of the mechanisms that harm endothelial function of arteries. A small study published in 2007 with 53 men suggested that pomegranate juice can bring subjective improvement in erectile function, but the result was not statistically significant. Other studies suggest general vascular benefit. The effect is modest. How to use: half a fresh pomegranate per day, or 150 to 200 milliliters of natural juice without sugar, 3 to 4 times a week. Caution: pomegranate can interact with medications like statins, anticoagulants like warfarin, and some antihypertensives. If you use those medications, talk to your doctor before consuming large amounts of pomegranate. The third fruit is red berries: blueberry, strawberry, raspberry, blackberry. They contain a special class of flavonoids called anthocyanins, which give the red and purple color. A large study from Harvard University, published in 2016, analyzed 50,000 men over 10 years. Those who consumed more flavonoids, mainly from red berries and citrus, had 14% less risk of developing erectile dysfunction. Attention: this study is observational, shows association, doesn't prove direct cause, but it's consistent with what's known about the role of flavonoids in endothelial function. How to use: 1 cup of varied red berries per day, natural or frozen, without sugar. You can use in plain yogurt, in smoothies, or pure. 5 to 7 times a week brings more benefit. The fourth fruit is dark grape or whole grape juice without added sugar. Dark grape, especially with skin and seeds, contains resveratrol and proanthocyanidins. These compounds have antioxidant effect and can support vascular function. The effect is modest, and the most consistent study is in other cardiovascular outcomes, not directly in erectile function. But as part of a Mediterranean diet which has proven to reduce cardiovascular disease risk and improve sexual function, dark grape helps. How to use: a portion of dark grapes with skin, or 150 milliliters of whole grape juice without sugar, 3 to 4 times a week. Notice something important. None of these fruits is magical. They have modest effects and act mainly improving general vascular function. The benefit for sexual function is part of a greater benefit for the heart, for blood vessels, for circulation. Those who benefit most are not those who expect a miracle. They are those who combine these fruits with broad lifestyle changes under medical follow-up. God bless you and give you much health. Until next time, tell me in the comments, had you heard about these 4 fruits before? Let's debunk important myths. Myth 1. Fruit replaces sildenafil or tadalafil. False. Modern medications for erectile dysfunction are very effective, have effect in 60 to 70% of men, and are well studied for more than 25 years. Fruits have much smaller and slower effect. Fruits help, but don't replace. Myth 2. Erectile dysfunction is normal aging and has no solution without medication. False. In many cases, lifestyle change and treatment of causes resolves without needing medication. In others, with medication it resolves very well. Don't accept it as destiny. Myth 3. Natural supplements are always safe. False. Supplements like ginseng, yohimbe, maca can interact with heart medications, antihypertensives, antidepressants. Always talk to the doctor. Myth 4. If just fruit resolves, I don't need a doctor. Extremely dangerous. Erectile dysfunction at 60 can be the first sign of heart disease. Investigating is vital. Myth 5. If it doesn't work with medication, it's all psychological. False. It can be low testosterone, severe vascular problem, neurological problem, effect of other medications. Specialized investigation is necessary. Frequently asked questions. How long until I notice difference eating these fruits? The vascular effects of dietary changes appear between 4 and 12 weeks, in general, but this varies greatly between people, and the effects on erectile function are modest. Don't expect dramatic change in a week. Can I trust aphrodisiac teas sold online? Don't trust them. Many contain hidden sildenafil without informing in unpredictable doses and can cause cardiovascular accidents. Others contain prohibited substances. Buy only at pharmacy with prescription and medical guidance. I have diabetes and hypertension. Can I eat these fruits? Yes, generally, but in moderate portions. Diabetics. Special attention to watermelon by glycemic index. Combining with protein or good fat helps avoid glucose spike. Use pomegranate juice with moderation if you control glucose. And always talk to nutritionist and doctor. I had prostate surgery. Does that affect? Yes, prostate surgeries can affect erectile function depending on technique and nerve status. Talk to your urologist about options, including penile rehabilitation with PDE5 inhibitors in specific doses. What else helps besides fruits? Habits. Quitting smoking is what helps most. Daily walk of 30 minutes. Weight control. Strict control of diabetes and blood pressure. Quality sleep. Stress management. Couples therapy if there's relationship strain. All of this added has greater effect than any fruit alone. Let's go to a practical action plan in 7 points. First, schedule a consultation with urologist and cardiologist. Do basic exams: blood glucose, glycated hemoglobin, complete cholesterol, kidney function, total testosterone, electrocardiogram, and if necessary, prostate ultrasound. Second, don't suspend medications. If you think one interferes, bring it to the doctor to adjust. Third, include the 4 fruits in your week, without excess, within a healthy diet. Fourth, walk at least 30 minutes per day. That improves endothelial function more than any supplement. Fifth, quit smoking. Cigarettes destroy blood vessels throughout the body. Sixth, sleep well. Sleep apnea is an important cause of erectile dysfunction in men over 50. Seventh, talk openly with your partner. Often, performance anxiety worsens everything. Couples therapy can help more than imagined. Let's go to an important reflection. Sexual function at 60 or older is different from function at 20, and that's fine. Intimacy at this phase of life can be slower, more connected, more affectionate. Don't try to seek the performance of when you were 18. That won't come back, and that promise in the video title is irresponsible. But you can, yes, have a satisfying intimate life with health, affection, pleasure. That's realistic, that's achievable. And that goes through caring for the whole body, the heart, the vessels, weight, sleep, stress, relationship. The 4 fruits are one part. The bigger part is everything that involves integral healthcare at 60 or older. Speaking of partnership, it's important to highlight one thing. Erectile dysfunction affects 2, you and the person who is with you. Many couples suffer in silence. Many women misunderstand, thinking the partner no longer desires them. Many men avoid intimacy out of shame. That silence makes everything worse. Talking with the partner with transparency, without shame, is the first step. Seeking medical help together can relieve much tension, and if there's effective wear, couples therapy can rekindle a closeness that seemed lost. Going back to nutrition. Besides the 4 fruits, it's worth remembering other foods that support vascular health. Extra virgin olive oil, fatty fish like sardines and salmon, rich in omega-3, nuts like walnut and almond, in small portion. Dark green leafy vegetables, beet, which also has natural nitrates with vasodilator effect. Raw garlic in small quantity. Dark cocoa in small portion. That food combination is what's called Mediterranean diet and has consistent evidence of reducing cardiovascular disease and improving sexual function in men over 50. And the foods to avoid? Processed meats like sausage and bologna, excess sugar, fried foods, excess alcoholic beverages, sodas, processed meats, fast food. These foods harm the endothelium, increase inflammation, worsen circulation. Reducing doesn't mean prohibiting totally, but avoiding as the base of nutrition. Talking about cigarettes. If you smoke, quitting smoking is what will most help your sexual function. Cigarettes destroy the endothelium of arteries, including the penile ones. Studies show that men who quit smoking have significant improvement in erectile function in a few months. It's not easy to quit, but every effort is worth it. Seek medical support, nicotine replacement therapy, psychotherapy. Quit lines and Medicare cover help programs. Take advantage. About exercises. Daily walking of 30 minutes works wonders for vascular endothelium. Strength exercise with light weights or elastic bands 2 to 3 times a week helps maintain testosterone and muscle mass. Specific pelvic floor exercises, known as Kegels for men, can also help in selected cases. Seek guidance from physiotherapists specialized in male pelvic health. Talking about testosterone. At 60, it's common for testosterone to be lower than at 20, but if it's significantly low, with symptoms like extreme fatigue, loss of muscle mass, depression, low libido, it's worth investigating with endocrinologist. Testosterone replacement, when judiciously indicated, can help, but attention, never do it on your own. Poorly indicated replacement can cause prostate problems, blood alterations, and other effects. About prostate. Enlarged prostate, common at 60 or older, can indirectly interfere with sexual function. Urinary symptoms bother. Some prostate medications can affect erection and ejaculation. Prostate surgery can also affect. So, urologist should be part of your health team. Don't avoid the exam out of shame. The modern exam is quick, simple, and can save your life. About modern medications for erectile dysfunction. Sildenafil, tadalafil, vardenafil are well studied for many years, have cheap generics available. They work by enhancing the effect of nitric oxide on penile vessels. They have important contraindications, mainly use of nitrates and some heart problems. So they should be used with medical prescription and cardiological evaluation. Don't buy online. Don't use without guidance. In adequate doses, they are safe and very effective. Accepting to use a medication is not weakness. It's self-care, a reflection on mental health. Depression and anxiety are very common causes of erectile dysfunction at 60 or older. Retirement, loss of close partners, change of roles in the family can deeply affect mood. Seeking psychological or psychiatric help is not weakness, it's care. If you've felt sad for more than 2 weeks without spirit, with negative thoughts, talk to your doctor. Treating depression often also improves sexual function. And if you use antidepressant and it interferes with sexuality, bring that question to the psychiatrist to adjust dose or change the medication. There are options with less effect on sexual function. About sleep. Obstructive sleep apnea is an underestimated cause of erectile dysfunction. Men who snore loudly, have breathing pauses during sleep, wake tired, have poor sleep, may have apnea. Apnea reduces nocturnal oxygenation, harms the heart and vessels, and reduces testosterone. Investigation with polysomnography and treatment with CPAP, when indicated, significantly improves sexual function. An honest, practical summary. The 4 fruits that support circulation are watermelon for L-citrulline, pomegranate for antioxidants, red berries for flavonoids, and dark grapes for resveratrol. They have modest effect, are adjuvants, and work within a healthy life. But the real path to healthy sexual function at 60 or older includes complete medical investigation with urologist and cardiologist, strict control of blood pressure and diabetes, quitting smoking, walking every day, controlling weight, sleeping well, managing stress, talking with partner, considering psychological therapy if there's depression or anxiety, and using modern medications with prescription when indicated. All added is what works. God bless you and give you much health. Until next time. If this video helped you, share it with someone you love. Take care of yourself with wisdom, with patience, with true information, and with much self-love. You deserve real health, respectful and pleasant intimate life, days with energy, and nights with peace. God bless you. Until next time. Amen. Share with those you love, especially with men who also face this question in silence. Breaking that silence is the first step to seeking help. God bless you. Until next time. Amen. Health and blessings. Take care always. Keep faith and daily care. God bless you. Until next time. Amen. Health, peace and faith. Amen. God bless you. Until next time. Amen. Take care with love. Your health matters. Your intimate life matters. Your relationship matters. Until next time, amen. Live with awareness, live with care, live with self-love. God bless you. Until next time, amen. Peace, health, faith, and love. Amen. Care for what you eat, when you eat, how you move, how you rest. Small choices build a healthy life. Trust real care, medical follow-up, the correct investigation of causes. God bless you. Until next time, amen. And whenever you have doubts, talk to your doctor, your urologist, your cardiologist. They are there to help you. God bless you. See you soon. Share with a friend, a brother, someone dear who also faces this. Information saves lives. God bless you. Until next time, amen. The journey toward better intimate health at 60 or older is a journey of patience and integrated care. There's no magic potion, no miracle fruit, no shortcut. There's consistent attention to the whole body. Heart healthy, vessels healthy, sleep restorative, weight balanced, blood sugar controlled, stress managed, relationships nurtured. All this together creates the foundation for sexual health that's realistic and sustainable. Don't fall for promises of returning to 18. Aim for the best version of 60, of 70, of 80. That version is healthy, alive, present, connected. That version is achievable. God bless you. Until next time, amen. Live with awareness. Live with care. Live with self-love. God bless you. Until next time, amen. Peace, health, faith, and love. Amen. Care for your heart, care for your life, care for your intimacy with responsibility and wisdom. God bless you. Until next time, amen. Blessings for your family, for your partner, for your health. Amen. God bless you. Until next time, amen. Good night. Take care. Amen. Trust the process, trust the journey, trust your doctor. Real health comes from real care. God bless you. Until next time, amen. Peace and blessings. Take responsibility for your health journey. Make appointments. Do exams. Walk daily. Choose foods that nourish. Sleep deeply. Connect with loved ones. These choices accumulate into a life of vitality. God bless you. Until next time, amen. Life is precious. Health is precious. You are precious. Show yourself that value. God bless you. Until next time, amen. Be patient with yourself. Change takes time. Healing takes time. Trust the process. God bless you. Until next time, amen. God bless you and give you much health. Amen. Until next time, amen. Peace. Sleep well. Take care. Be well. Amen. Bless you all. Amen. Faith, love. Amen. Hope.